Welcome everyone to our brand new show, EzeRx Ask the Expert. I'm Shweta. I'm from EzeRx. So today we have Dr. Sonal Sharma. She is an extreme known public health specialist. Hi ma'am, how are you?
Hello, I'm good. I'm good. How are you
Okay ma'am.
doing?
Okay, I'm all good ma'am. So can you please
Okay.
describe about your career and about you to our audience a little bit?
I'll just give a very brief, humble introduction about myself. I'm a general physician by my education. I have completed my MBBS and I'm moving towards my public health specialist career. Right now, my focus in my career is towards spreading awareness about the diseases as much as I can. So I'm very like privileged to be a part of this initiative, and I'm very happy about that.
That's great, ma'am. Okay, so let's start with our today's topic. So, ma'am, can you just tell us about anemia? What is anemia and all?
So we know that blood is composed of multiple components like RBCs, WBCs, and platelets. And anemia is basically the decrease in the number of RBCs, that is the red blood cells, or the decrease in the amount of hemoglobin in the blood. Hemoglobin is the protein that is attached to the RBCs, which connects to the oxygen in the lung and carries it towards the organs and vital tissues in our body. If there is a reduced ability to carry that oxygen to the various parts of the body, it might lead to symptoms such as fatigue, weakness, pale skin, shortness of breath, and even dizziness.
And can you just tell me about what type of anemia there are?
If we take a step back, we can broadly classify anemia into three categories. That is basically on the morphological classification, which is the size of the RBC or the red blood cell. It can be divided into microcytic, macrocytic, and normocytic anemia. It can also be divided into etiological classification, which is due to the some underlying cause which is causing anemia. It can be due to impaired red cell production or due to excess red blood cell destruction, which is also known as hemolytic anemia, or due to excessive blood loss from the body. Lastly, we also classify it on the basis of reticulocyte response. But for the sake of better understanding, I think it's better to look on the most common types of anemia that are present in India and which are a big global burden. That are the iron deficiency anemia, vitamin B12 and folate deficiency, along with the parasitic infection deficiencies and the anemia of chronic diseases.
Okay, so how can we prevent that anemia?
While many types of anemia cannot be prevented, but there are some anemias like iron deficiency anemia and vitamin deficiencies that can be easily prevented by just having healthy foods. And they can be achieved by diversifying your diet. We should ensure to have a varied and balanced diet to receive the broad spectrum of nutrients that are necessary for our overall health. We should avoid the excessive consumption of alcohol or even excessive consumption of anything which might lead to obesity and other diseases that might lead to anemia. And we can maintain a healthy lifestyle by exercising regularly, get adequate rest and sleep, which supports our natural body functions. And the last thing I think, which is the most important thing, is seeking regular health checkups at your nearby primary healthcare center or any family physician that you wish to go to, so that they can identify and address any potential health issue, including anemia, at a very early stage. And it will also help you to manage the chronic diseases that might contribute to anemia.
Okay, so can you just suggest us some diet chart or something like that to prevent the anemia?
It is very easy to fulfill our nutrient demands in the body, and it can be done by just keeping two main things in mind, that is having a healthy diet, and second is maintaining a good absorption of those nutrients in our body. By healthy diet, I mean you can have I mean it's a very telltale thing that our grandmothers also used to say, that have green leafy vegetables like broccoli, spinach, fenugreek, that is methi, and cholai leaves, and even lettuce that we can put in our salads. Apart from that, we can have dry fruits like raisins and almonds. And the non-vegetarians, the meat eaters, can have red meat, but in moderation. Even they can have pork and lamb. And if vegetarians can incorporate some amount of egg in their diet, then it will also give sufficient nutrition to the body. And to increase the absorption of the nutrients in the body, we should pair foods with vitamin C rich foods such as cauliflower, tomato, apple, and orange, along with the iron rich foods. And the things that we should avoid are usually the coffee and tea intake during the meal, during or after the meal, because it actively hinders the absorption of iron and other nutrients in the body.
Okay. So as we know, this is a blood issues problem. So how can that affect to a pregnant lady?
Well, imagine the red blood cells are like small, tiny delivery trucks that are carrying life supporting oxygen to each and every part of our body. And when a woman is pregnant, her body has to work even harder to supply that oxygen not only to herself but also to that developing fetus. And anemia disrupts this essential delivery system by affecting both mother and the baby.
Okay.
You will be surprised to know that in India, approximately 57% of pregnant women are affected by anemia, even when we have so many interventions that have been taken place. And anemic women often experience increased tiredness. They have risk of complication for themselves.
That's a really large number.
Yeah, and it's a very big burden and concern that we should be looking into. And it's not just about the mother, it's also about the baby. Because if she has anemia while she is pregnant, then it can cause the baby to be of low birth weight when it is born. And he or she might be born on a preterm basis, which also creates a higher risk of the baby dying after birth. Anemia also makes the mother and the baby more susceptible to infections because of the weakened immune system of the mother. So, therefore, to prevent this, I think prenatal care is extremely essential with regular health checkups and blood tests.
Okay. So if it's like that much harmful for the mother as well, this is also harmful for the children.
Of course, it is very important for the children as well, and you'll be even surprised to know that children recently the survey that came out, it showed that around 67% of children in the age group of 6 to 59 months of age were affected by anemia.
Okay.
And as children are growing, they have an increased demand of nutrients. And however, insufficient nutrients at a very early stage can lead to the developmental growth retardation of the baby, and even the milestones are delayed. The developmental milestones that a child should receive at a particular age are usually delayed. It also weakens the immune system of the child after it's being born, which it makes it susceptible to infection, and they get even sicker than their peers. I have noticed that there are two signs that parents usually ignore in their children after they are born, and when they are extremely young or in the school going age, that they have low level of energy. The child might look very tired and fatigued, and he or she is unable to concentrate in the class, and they have challenges focusing on the lessons, leading to academic difficulties. And I've seen the parents think that my child might just be lazy or academically challenged, when I think they should rethink everything and catch the problem before it becomes bigger for the child.
The health specialist. So how deadly is anemia according to you?
It is important to note that the severity of anemia varies and its impact can range from mild to severe. Anemia itself is not typically considered deadly, but its consequences after anemia, especially if it's left untreated or it becomes severe, can lead to serious health complications and contributes to the increased morbidity and mortality, specifically in the vulnerable populations. And severe anemia, as we have discussed earlier, that it can reduce the oxygen supply to vital organs. It might cause organ dysfunction and failure in a particular person. And if a person had a pre-existing cardiovascular condition, it might also lead to heart failure, or even otherwise it can lead to heart failure. These things can be easily prevented by just active management of the disease.
So like how government is taking their measurements and all.
Government has actually launched various programs throughout the years, and one of the main ones being Anemia Mukt Bharat, in which they target the children in the age group of 6 months to 5 years, And then after 9 years, they focus on the adolescent girls and boys. They also focus on the women of reproductive age and pregnant women who are lactating, and the mother who are about to give birth. They launched a weekly iron and folic acid supplementation in the areas which had high prevalence and incidences of anemia. It is usually given in the age group of the adolescent girls and boys. And since children are not very fond of taking medicines, so they have made it a routine that they supply weekly ingestion of iron and folic acid tablets to the children. And another one that had been launched recently is the Pradhan Mantri Surakshit Matritva Abhiyan. And it was launched to focus on the conduction of ANC, the antenatal care checkups, on every ninth of every month. So that if any woman is a pregnant woman is feeling or is having any difficulties, the medical officer or the OBGYN, the gynae obstetrician, can easily grab those diseases or any concerns, and they can provide the adequate medication whenever it is needed. And to overcome one, it's not common, but it's a very hidden cause of anemia, that is the worm infection. So the government is also giving biannual deworming to the children in rural areas.
Okay, it says only in rural areas, only.
Currently, it is there. But if you want to get your child dewormed at a like a local healthcare facility, you can definitely go there and have it done.
You said there are many children and many women are there. So can you just tell us about some tests to detect the anemia?
So when a patient comes to us with any complaint, we first do the physical examination. But specifically for anemia, there are four things that we look for. That is the color tint of the lower eyelid conjunctiva, which is if we lower the eyelid here, we can see it here. Then
Okay.
we look for the nail bed rubor, then the nail bed blanching, and the palmar crease rubor. We look at these sites because the color tint of these regions don't usually depend on the person's skin color due to the absence of melanocytes in those areas. And the presence of conjunctival pallor that I explained earlier is directly correlated to the condition of anemia, and it can determine the level of hemoglobin in your body to a vast extent. But this is just the physical examination. The traditional methods that were being used are the Sally's test and hemoglobinocide method, and we have azide method and reagentless methods. But these are all invasive and they are costly, time consuming. They require specific chemicals and equipments to diagnose that the hemoglobin is low.
Okay.
And most importantly, the chemicals that are used in this test are very biohazardous and pollutant to the environment. So, as we are moving towards a digital AI world, the artificial intelligence world, I think the non-invasive methods that are coming up, like EasyCheck non-invasive device, are becoming more and more acceptable in the society. As the invasive methods are extremely painful, risky, time-consuming, they also require experts to take samples and perform those estimation techniques. Therefore, the modern technology implementation and development of non-invasive methods are the need of an hour.
That's great. So, like to create the awareness in everywhere. Like there are many people who don't know that they have anemia.
Yes, of course. And that's a big issue in India. Creating awareness about anemia in India involves reaching out to diverse communities through targeted and culturally sensitive approaches, which are extremely multifaceted. So, one of the key strategies that I feel is very important is the incorporation of the healthcare professionals. We can partner with them, or we can go reach out to the primary healthcare clinics or the hospitals so that we can conduct awareness campaigns and effectively spread the information about anemia.
Okay.
Another vital thing about creating awareness is through community workshops and educational programs. These initiatives can be organized by communities, schools, local gathering places, and we can aim these programs to spread awareness about the simple causes, symptoms, and the basic things like prevention of anemia, as I discussed earlier, so that people have a very, they think about it and they get involved into it. And
Yes.
it also emphasizes then, and in those campaigns we should also emphasize the importance of regular health checkups, because you can of course get all the nutritional things in your body by yourself, but you will not know if you have a deficiency until unless you go to the healthcare professional and get yourself.
Most of the people don't know that they have anemia. Like some
Yeah.
ladies are also don't know.
More thing I would like to add for this, since like you said that most people don't know about anemia, this is also because of the language and the regional barriers in India. And we can break these barriers by taking leverage of the digital age, and we can utilize the local radios, television, or any broadcast service which can spread the awareness message. And we can also use graphics and videos which can be easily spread to the people, and they can see those visuals and understand what the message we are trying to give.
Yeah, definitely sure. Can you just tell me which are the anemia prone areas you know?
Anemia usually, prevalence of anemia usually tends to be higher in the rural areas, as we know, because the healthcare facilities and the nutritional resources provided to them are very limited. The
Yes.
challenges in the remote locations can contribute to the nutritional deficiency load throughout the country. The socio-economic factor, I think, also plays a very pivotal role and a vital role in the anemia prevalence. And as we have seen that the high poverty rate areas in India have experienced more anemia prevalence, as they don't have access to healthcare or basic education or nutritious food. And even in the urban areas, people don't know much about this, but as the cities are moving into urbanization, you will see urban slums being formed all around, and they have become a hotspot with suboptimal living conditions. In these areas, factors such as poor sanitation, crowded living spaces, and limited access to healthcare has also been contributing to higher rates of anemia in India.
As you told about rural areas, so in rural areas, most of the people are not aware about the campaigns and all. What step we should take?
This is a very good question. And recently I read it in a book that if you want to succeed in life, you need to have a partner to help you along with your journey. So, we're on our journey to spread awareness in the rural areas of India, we really need to engage the communities. And of course, it has been very challenging, but it's a crucial step to have a successful awareness campaign. I
Yes.
think firstly, we should emphasize the community involvement by engaging the community leaders or the influencers, even the residents who will be willing to volunteer in the campaign. And we should also keep in mind the cultural sensitivity of that area, so that we can tailor those campaigns according to the local culture, so that we are respecting the norms and the beliefs of the people over there. This not only builds trust among them, but also ensures the information is relevant and accessible to them. Of course, the communication skills are very important. That the person you are talking to does not understand what you are saying, then it's like it's of no use. So
Yeah.
you should always use the local language and words that are easily understandable by someone. Even door-to-door campaigns have proven to be very successful, and as they provide a very personal touch to the campaign.
So, ma'am, as you told about non-invasive hemoglobin testing device, so can you just tell us how can we use that in rural areas as well?
Of course, a non-invasive hemoglobin monitoring device like EasyCheck can be a valuable tool in rural areas, as the access to traditional healthcare facilities are very limited over there. These devices provide a way to access the hemoglobin levels without being in a fear of giving your blood sample to the person, and it makes them practical for the use of the community health settings. It provides a painless and quick measurement, and makes suitable for people who are very fearful of needles and don't like the invasive procedures done to them. So it eliminates the blood sample collection. It also reduces the risk of infection, even the infection via the needles that are introduced into our body is eliminated. And so the non-invasive device can be used in a setting where proper sanitization is not possible. So, of course, non-invasive devices are very often used and suitable for the mass screening in community health campaigns, as they give us a very rapid measurement without the need of trained professional to collect the blood sample.
That is a non-invasive device. Okay, so it's a offline device. So what is the benefits of that in rural areas?
Since we know that rural areas, of course, even in urban areas, there are many places that don't have the Wi-Fi connections or the internet connections over there. And so, if they are using the device in the rural areas, it can bring several benefits, addressing the specific challenges and increasing the effectiveness of anemia detection and management. Where the healthcare facilities are scarce, an offline anemia detection device proves to be a game changer. It is portable device and allows the healthcare workers to carry out screening directly in the remote villages. It overcomes the challenge of limited access to the medical centers as well. The connectivity issue, as I said, since the internet is not readily available everywhere,
Yes.
is sidestepped as the device operates offline. So it ensures that screening is even conducted when the internet is deprived in those locations. It also gives a real time result, and within seconds, you can get the result. And you don't have to wait for a report, and throughout the day, you are waiting for the report to come to your hand. So it of course increases the efficacy of the not only the screening but also the treatment and the management of the diseases. In a long term impact for non-invasive offline devices, they enable the implementation of sustainable monitoring programs, allowing the assessment of intervention effectively and have a successful public health campaign.
So after everything, at the end, we need to know what is the treatment of anemia.
It is important, very important to note that anemia, since anemia is of various causes, and appropriate treatment is dependent on the identification and addressing of the underlying factors. Like I gave you the classification of anemia, all the causes that are causing anemia are the first underlying factors that need to be addressed. If someone is suspected that they have anemia and they have symptoms like fatigue, weakness, pale skin, proper diagnosis and management is required. So after that, the treatment plan is usually tailored to the specific type and the cause of anemia, and the physician can provide a personalized guidance based on the individual health needs and circumstances.
Okay.
As I've discussed earlier, that anemia rates among Indian women and children remains around 20 to 15% higher, respectively, in the world average. And India, since being the largest population, contributes significantly to the global burden of anemia. It can affect people from all ages, races, and even ethnicities. And some, while being mild, some can be life threatening if not treated aggressively. However, the one good news I would give everyone is that anemia can often be successfully treated, and it can be actively prevented just by taking small steps towards the right direction.
Okay, ma'am. Thank you so much, ma'am, for giving us that much knowledge about anemia and about this treatment. So that's it for today. Uh,
Thank you so much. It was an honor to spread this awareness with
Thank you.
you.
We are really great to have you today.
Thank you so much.
Thank you, ma'am.
Bye.